I'd like to, again, extend my thanks to the panel for being here and all of you to be here. And I wish we could double, triple, quadruple the number of folks interested in state government and making our state government better. And really, ultimately, when we talked about the Constitution, when we talk about Constitutional Convention, whatever that might be, let's never forget the ultimate goal is how we can make New York State the best state in the Union. And where I think I'll borrow Bill Samuel's line, he says we want the Democrats to be very successful and we want the Republicans to be very successful because a strong two-party system has done very well for us over 200 plus years in our country. It needs some tweaks, and certainly I think we could afford some tweaks in New York State just to make us all more effective. My topic, I think most of you are already aware of, but just to kick it off, is unfunded mandates. Are they real or imagined? They're certainly real. You're talking about billions of dollars that are mandated by, quite frankly, it can start from the federal government to state government to local government. And the largest mandated, unfunded mandate program across the country and in New York State is Medicaid. It's not even close. And we're talking about billions of dollars where the federal government originally said, okay, we want to have Medicaid programs and have the states run their own program, and we'll provide 50 cents on the dollar. And then most states pick up the other 50 cents. In New York State, we've got 50 cents on the dollar for the federal government, 25 cents on a dollar, state government, and 25 cents on a dollar, local governments. And if you do any research at all, and like I said, I'm not going to bore you with lots of statistics, but in essence, if you talk to any county leader, they'll tell you that their largest tax impact on their county budgets is Medicaid. And over the years, New York State has taken what I'll call the basic standard plan of Medicaid outlined by the federal government, and over time has expanded services to Medicaid. So we have the most expansive Medicaid program in the country in terms of services offered, but unfortunately, along with that, the highest cost program in the country. Our Medicaid costs on an annual basis, we have a little over 19 million people. Our Medicaid costs are greater than the states of Florida and Texas combined. We're ahead of California, and California's got 33 million people. Texas and Florida combined are over 43 million people. When you look at that model, that's not sustainable. And certainly when you look upstate in particular, all of that is funded out of property taxes. And when you've heard the outcry, regardless of any place in the state you go about property taxes, it's Medicaid that's driving up those costs. Now let me be clear, and I always say this to my constituents as well, I'm not advocating that we cut, slash, and burn the Medicaid program. Absolutely not. By any conservative measure, we probably have at least $4 billion right here in New York State on an annual basis through waste, fraud, and abuse. And you hear stories all the time about that through the Attorney General's office, prosecutions, physicians writing scripts that shouldn't be written. Even in my area that I represent, I had a town hall meeting a couple of years ago, and actually the communities these two communities are so small, I had a town hall meeting with the two towns together. And two separate constituents say, you know, I don't understand how my mom or dad was able to get this motorized scooter that I know costs over $5,000 on their Medicaid program, and all it does is sit in their garage. How does that happen? And of course I said, I don't know. But that's the problem. These are in two of the smallest towns in the entire New York State. So if you start thinking about our urban areas, and you also talk about even counties that are experimenting with computer models to track how prescriptions are being written, the cost of them in one part of the county versus another. There's all sorts of minutia that you could get into, but all it really underscores is Medicaid's out of control and we're all paying for it. And when some of the things that we've talked about, for instance, because New York State government mandates the program, is that then let New York State pay for it. If you think it's such a great idea, don't put the burden on local governments, because that's where the local tax burden drives up our combined tax burden of state and local tax burden in the country. Is if we're not number one, we're at least number two. And that's the complaint when you hear from local governments and school districts about New York State government. You know, in the last 12 years, I just did a quick check just to give you an example. Between 2001 and 2012, the Assembly, New York State Assembly, voted 120 times to pass legislation that had some sort of unfunded mandate. That's that direction where you're going to do this, but you're going to have to figure out a way to pay for it yourself. That fiscal impact over those 12 years is over $85 billion. $85 billion. These are serious numbers. And so right now what you're hearing is an outcry from local governments and school districts saying, you know, and we've all heard of the property tax cap, and they're saying, well, you're tying our hands on the tax cap, but you're not giving us any relief on the cost side. And I think this is going to be a major discussion in the 2013-2014 cycle. Now, I will tell you that the property tax cap did create some mandate relief. That is, in 3 years, we phase in the state takeover of increased cost of Medicaid going forward 3 years from now. So that the county costs on Medicaid will ceiling out in 3 years. That is some mandate relief. I would have liked to have seen it. We actually introduced an amendment this year to cap Medicaid costs of the counties right now and let the state pick it up. Because we have to try to get the state to have some incentive to fix the program. And whether it's also including in, you know, getting the Inspector General's office more involved, there's money to be saved, and not without, if you will, hurting senior citizens or the disabled community in our state or low-income folks from getting help that they need. And I think that's sometimes what's one of the misnomers that's thrown about when we talk about saving money on Medicaid, that, oh, those Republicans, they just want to, you know, cut entitlements, or they want to put poor folks out on the street. That couldn't be farther from the truth. You know, I'm a business guy. I ran a business. I owned a business. I worked for large and small companies, international companies. And basically, you know, I think I know what it is to protect and make sure we're getting the most efficient use out of our dollars. And I think the local taxpayers, that's what they're really looking for. They don't mind supporting with their taxes good government-run programs, if they're good and if they're run well. But where you'll get the complaints back home and from local governments is when they see the waste, the fraud, the abuse, people that are getting benefits that shouldn't be getting benefits, if there's loopholes in estate planning on Medicaid where people are hiding their assets, you know, those things need to be fixed. So, but this is just a small conversation or one of the small conversations or many conversations that we have to have if we're going to, if you will, have an affordable state and local government to serve the people that we all represent. And my point is that we should never demonize people for bringing up these questions. And that's the problem with politics, is that people demonize the other side for being insensitive, or they don't care about someone that's have a poor lot in life. All I'm just trying to tell you, I couldn't be farther from the truth. The truth is, we are on a, and I'm not going to use that word because it's overused, but we are in a fiscal crisis in this state. Just as Hurricane Sandy is going to exacerbate that situation for our economy. And so we have to start talking about these issues. And really, my whole point with Medicaid, I mean, if you just looked at some of the, and these are just a smattering, but you got Medicaid costs, annual costs, county costs over $8 billion, pensions, $900 million, preschool education, $653 million, safety net program, $1 billion, child welfare, early intervention, indigent defendants, public health services. All of these things are mandated by the state, but nobody gives any financial help. And my point is, let's say they're all great programs and we should do it. Then let's share those costs by everybody in New York State and not put the focus on the local governments and school districts. And school districts have got their own list. And really, that's why we keep talking about it. And we had pension reform this year, Tier 6. There was a significant amount of opposition to pension reform, as you can well imagine. It still got passed, but that pension reform is really a down the road, does nothing to do with the pocketbook costs today. And that's not going to get any easier. Tom DiNapoli is basically saying, well, we're going to have to send a bill to municipalities that they're going to have to increase their contributions to the pension system by 25%, 30%, 35%. Ladies and gentlemen, those folks back home can't afford that. And I'm not advocating the perfect solution here, but I'm just saying it's real. It's not a funny number. It's not imagined. This is real-time stuff, and that's why you'll hear ongoing from NISAC and NICOM and the School Boards Association, school superintendents that, hey, we got to do something. Help us. Can you help us in other areas? If you can't touch pensions, what can you do to help us? What can we do to bring the unions to the table to help negotiate long-term, keep jobs, but maybe lower the cost of those employee packages? So there's a lot of things to talk about in that regard, and certainly to sort of close, because I could really talk about a lot of different things based on my experience. But I grew up in the city of Rochester the early part of my life, and then I moved out to the country, to Canandaigua, and so I come from upstate. I'm the only upstate leader at the legislative leaders table, but I wear two hats, or three hats. One, I represent my district. Number two is I represent all of our members of our conference, which is statewide. And then I pride myself on being a voice at the table for upstate New York, because quite frankly, our state government is dominated by downstate interests and representatives, which I get. But you can't forget the 8 million people upstate that are trying to hang on with their fingernails, and people that are losing their families moving out of state because there's not good paying jobs in upstate. That used to be a very strong manufacturing economy that has taken a real hit. So there's lots of ways to remedy all these issues, but we have to have a willingness to sit down and openly discuss it, open our ears, do more listening than talking, and then recognize that we do have regional differences. And that's another thing that I've suggested is let's have more optional programs. So if something really works for the New York City delegation for their constituents, even on Medicaid, let them have what they want to have on a local basis, but don't burden Ontario County or Yates County or Wyoming County with a across-the-board state-mandated program that does not fit the people that they serve. And I think that's the type of approach we have to start looking at: regional, optional, more flexibility, and understand that we've all got different issues, priorities on the constituents that we represent. And I understand the needs of the New York City legislators. I'm just saying you need to understand upstate. And most of our downstate legislators have never set foot in upstate New York, to travel around the state just to get a flavor of how people live. They actually use cars to get back and forth to work. We've got an agricultural community. So there's a lot of these variances, and I just use Medicaid as the jump off on that. But we have some opportunities here, and one of the last things I'll say to you, because I know you got lunch coming, is that when I talked about having a constitutional convention, and I heard one of the questions earlier, and I don't know what it was because I was in the off room, about, is changing the Constitution, is it going to really prevent the legislature from either mucking it up or trying to go around it? I don't know. All I'm saying is I think it's been proven out at the national level and sometimes and many times at the state level. When it comes to politics, legislators don't want to have the political courage to make the tough decisions to really fix things that need to be fixed. And I just looked at a constitutional convention as an opportunity to maybe change the Constitution by people that are elected by the people, that it can't be an elected official, by the way, or current legislator, so you don't have the same crowd running the same thing. And then whatever they come up with, let the voters decide in New York State. Now, if it works, great. If it doesn't work, what have we lost? Well, there's some money, some time, and some effort. And I think, again, we have to be open to a lot of different ideas, discussion points, flexibility on addressing these issues, because they're complex. They're not simple solutions. But if you don't have people that are willing to sit down and talk about this in a real fashion outside the political realm, then you're right. It's not going to change.